Intraoral lesions tend to precede the cutaneous rash and can appear on any mucosal surface. These lesions, in the form of vesicles, don't hold back. They rupture, ulcerate, and become painfully unpleasant. Today, I'm going to talk about hand, foot, and mouth disease that affects people, especially kids, around the world. It might not sound like much, but trust me, this viral villain is quite the interesting character. In this video, I will cover how this disease spreads, which population is most at risk, how this disease develops, its intra and extraoral manifestations, differential diagnosis, treatment and prognosis, as well as its dental implication. First off, let's talk about how this disease spreads. Hand, foot, and mouth disease, or HFMD, is caused by the Coxsackie A16 virus and some other Coxsackie strains. It is a sneaky microorganism transmitted through the air, orophycal routes, respiratory droplets, and even latching onto everyday objects we call fomites. The virus likes to party in your oropharyngeal cavity and small bowel. And here's the kicker. Once you're infected with one strain, you are immune to that specific one, but other strains can swoop in later. According to CDC, hand, foot, and mouth disease spreads during the first week of symptoms and can remain contagious for up to a few weeks. HFMD is not a lone wolf. It is highly contagious, and you can keep shedding the virus for up to 2 weeks after the acute infection. According to the research conducted by Solomon and his team, the virus was even found in stool samples for up to 11 weeks. Now, let's look at who's the most at risk. HFMD loves to pick on kids, especially those under 5, and it can stretch its grip up to kids around 10 years old. Why? Well, it is all about the close contact they have with each other, whether at school or the daycare. And interestingly, boys and girls are equally vulnerable to its clutches. Picture this. HFMD likes to take its time. With an incubation period of 4 to 7 days, that means the virus stays in your body up to a week without you even realizing it. Often showing up in the summer or early fall. But here's the good part. It usually packs up and leaves in just 1 to 2 weeks. However, it is not a silent visitor. It comes with a wide range of symptoms, including fever, sore throat, malaise, and lymphadenopathy. Now, let's focus on the external signs of HFMD. This viral troublemaker loves to make a grand entrance on the soles of your feet and the palms of your hands. These lesions may develop central vesicles, which can be quite dramatic, as if they decide whether to burst and form crusts before ultimately healing. It is like a miniature fireworks show on your skin.
Hello.
Inside your mouth, HFMD is no less of a drama queen. Intraoral lesions tend to precede the cutaneous rash and can appear on any mucosal surface. These lesions, in the form of vesicles, don't hold back. They rupture, ulcerate, and become painfully unpleasant. Think of them as close relatives to herpangina. You will find these lesions on the tongue, the palate, and the buccal mucosa, making it a full-scale oral affair. Distinguishing HFMD is easier than you might think, where its stress tells the tale. Buccal mucosa, tongue, and hot palate in the mouth, and hands and feet externally. It is like a secret code written on the skin. For the microscopic enthusiasts out there, HFMD's show starts with intraepithelial vesicles that precede shallow ulcerations. Think of it as the opening act in a microscopic theater production. Let's not forget the dental aspects. HFMD's oral lesions can cause pain and make eating and swallowing feel like an Olympic event. Now you know that the palms and the soles are HFMD's favorite hiding spots, but don't be fooled by the similarity to primary hepatic gingival stomatitis or varicella at first glance. So, what's the good news? HFMD is not here to stay. With treatments focused on symptoms relief using antivirotic agents and topical medications, recovery is on the horizon. The prognosis is excellent, and complications are not expected.
Nice.
But keep in mind, this virus is a sly character, and it can invite other family members to the party. So, make sure to practice good hand hygiene and be vigilant about potential exposures. As a dental hygienist, there are many health and dental questions to ask our patient to further rule in or out the disease. First, have you noticed any unusual sores or blisters in your mouth, on your hands or feet? That could help us for differential diagnosis, because we would not normally check the feet, but it is the favorite place of the virus. Since the lesion can be on the tongue, palate, and buccal mucosa, we could ask our patient if they had any difficulty eating, drinking, or swallowing recently. Then, we could ask if the patient have been feeling unwell and experiencing some typical symptoms of HFMD, such as fever, sore throat, or malaise. Children are the most common carriers of HFMD. A dental hygienist might ask a parent if their child has had any close contact with people who have HFMD or similar symptoms. Virus always targets people who are stressed and weak, so we can ask if the patient is currently taking any medications or have any chronic medical conditions that might affect their immune system. The vesicles or sores that appear on the palms, soles of the feet, and inside the mouth are the typical characterization of hand, foot, and mouth disease. Symptoms like a fever, a sore throat, and a general feeling of malaise often accompany these lesions, which can be quite painful. Recognizing HFMD's clinical features is only half the battle. Knowing what to do if you encounter a case in a dental setting is equally important. Both patients and healthcare providers need to be kept safe. So, it is important to be proactive about communicating with and guiding the patient's family.